Good afternoon. I'm Amit Agrawal, professor in mechanical engineering at IIT Bombay. Our group has been involved in the development of novel biomicrodevices. Here I will be talking about a platform technology which we have developed for separating plasma from blood. We have also subjected this device to clinical testing for early stage detection of cancer. This work is, we have Embryo Technology Pune as a partner in this work here. So, the collection of blood has become very common these days. You know that a person can come to the house and can collect the sample from the patient. So the thing is, instead of taking the blood back to the clinic and doing the test, can something more be done after collecting the blood, and maybe some of the parameters can be given to the patient right there and then. So that's the problem statement that we are looking at. So we essentially want to develop a point of care micro device. And when you think of how that device would look like, there will be two modules. One which will be a sample preparation module, which will take the blood which has been drawn from the patient, to extract the plasma out from that blood, and then they put it in the second module where it will be used for detecting whatever quantity is of interest to you. Now you can very easily see that the current method of centrifugation is not enough because it cannot be carried with that person. Uh, we also cannot have any filter based techniques because it will reduce the sensitivity of the test. So you can see that in that context, we developed this technology, which is a flow-based separation of the device of the plasma from blood that happens. So the closer view of what is happening at the separator is what is shown on the right figure, whereas this video is showing an embodiment which has been developed by Embryo, where all this plasma is getting collected uh, from various, from blood. So of course there is great science behind how it has been developed, which I will not get into. But moving ahead, I will take just one use case to see how this technique has been employed. Okay, and of course this is a platform technology, so it can be applied in so many other cases than what I'm going to talk about. But this is just one use case to illustrate that. So this is for early stage detection of cancer. As you know that tissue biopsy is what is currently being done, and tissue biopsy is a very painful process. Uh, and of course, because extracting that tissue is of course a painful process for the patient. And then if you are looking at a patient who may have recovered after treatment, and whether the treatment has been, how successful that has been. So for that you need to do this sort of a test more quickly, and it is not possible to keep on extracting tissue from there. So in that context, if you can actually use a liquid biopsy based technique, it becomes more attractive for you. And this is what is being proposed, is that you can use, why not just use blood, and why not just use cancer related biomarkers from that blood for testing of cancer itself. However, this technique, although it may sound very interesting, it is still is in infancy. And therefore, what we are proposing is that this device that I demonstrated in the previous slide can be used for extracting high quality plasma. And the hypothesis that we had is that it will be of much better quality. The plasma that you would get would be a much better quality as compared to what we will get from a centrifuge. And that would help in detecting the cancer early as compared to what you can detect, because the sensitivity of the test is far better now. So with that in mind, these clinical tests were done on actual patient of cancer patients. And you can see this blood is taken. It has been divided into two parts. One is which is taken to the centrifuge, and the other one is taken through our device. And then further post processing of this plasma is as whatever is being done right now. And what we will say is that this has been a very successful, or at least a very promising thing, that we are able to show that our device is at least as good as a centrifuge. And because this clinical testing are still going on, we are very hopeful, or we sort of know that we will be able to prove that our micro device is actually better than the gold standard, which is the centrifuge. So this is just one use, and because this is a platform technology, one can use it in so many other cases. So our potential customers could be diagnostic centers, research labs, as well as it could be in the rural healthcare centers. And there are a lot of value propositions that we can have in terms of the reliability of the results, in terms of the processing time that is involved, in terms of the high quality of plasma, which I have already demonstrated, and in terms of the economic benefits that it will provide to the stakeholders. So these are some embodiments of our products that we would have, and so this is now, of course, one can use it. So I mean, one can have a benchtop thing like a centrifuge, or one can have a handheld thing, and these have already been realized and ready for commercialization. Thank you.